So, without further ado, I'm delighted to welcome Beck Hanley here. Beck has spent the last 25 years or more maybe working in the space of promoting the involvement of people who use services in health care and health research. Beck was the founding director of the NIHR Involve Coordinating Centre. We've all heard of Involve. It was the gospel, according to Involve, was how we all began our PPI journeys. So it's a wonderful thing to have been so central to for so long. Beck has worked with a range of UK charities at a national level, focusing on the development of the public and patient voice in research. And she's also worked with the NHS at a local, regional and national level, and has worked with research organisations across the UK, in Canada, in Ireland and in Australia. So quite a breadth of experience that Beck is bringing to us today. And she's a particular interest in PPI and clinical trials, and works as an advisor to the Medical Research Council in the UK. So we're delighted to welcome Beck here today, and probably a number of people from the Irish charities will also recognise her as the facilitator of the Charities Research Involvement Group in the UK, which in ways is like a sister organisation of the health research charities here and their focus on PPI. So Beck, welcome, and I'll hand over to you.
I'm just going to grab my phone, not because I'm going to be doing Twitter or anything during this, but I stopped wearing a watch during COVID, so I never know what time it is anymore, and I don't want to overrun. So, so thank you very, very much for having me. It's a great pleasure to be here. I got to Ireland on Monday, and I spent some time in Cork at the University College Cork, and then I've been in Dublin yesterday and today, and I continue to be genuinely in awe of what's happening in Ireland. I think you are all doing amazing things, and you're moving so fast. So I just congratulate yourselves, because you're really doing a great job. This is what I'm going to talk about today. I'm definitely not saying that we've got the answers in the UK. Definitely not saying that. But in the spirit of this festival's theme of collaboration, I just wanted to share with you some of the challenges that we're facing and some of the ways that we're starting to try and address those challenges. So I'm going to talk about 4 areas, and I'm assuming that some of these things will reverberate with you. And I know from what I've heard so far during the festival that people are talking about some of these things. So I'm going to talk about, guess what, diversity and inclusion. I'm going to talk about how we capture the impact of involvement. Talk a little bit about payment for involvement, and then I'm going to talk about culture change. And with each of those things, I'm going to, just as I say, talk about the challenges that we're facing, or some of the many challenges, but also talking about what we're going to try and do. So I've been working in this field, as Edel said, I've been working in this field for about 25 years, so I reckon I should get time off now for good behaviour. But I just want to pay tribute particularly to some of the groups of people with lived experience who really pioneered this work well before I got involved. So I think some of the work started particularly in other countries with Indigenous people. So you see amazing work that's gone on in Australia, for example, with Aboriginal and Torres Strait Islander people. But in the UK and Ireland, certainly what I saw was really great stuff done by women, so promoting involvement in breast cancer research and in pregnancy and early childcare research. Involvement, people with HIV or AIDS fighting to get involved in that kind of research, particularly in the early days. Mental health service users and people with physical disabilities really led the way in this field. As I say, I started working in this field in about 1996, feels like a long time ago now. But in 2005, we set up something called a shared learning group. So the idea was to bring together charities, UK-based charities, that had an interest in involving people, not just in research, but right across the piece. And then in 2013, we set up this thing that has become known as the Charities Research Involvement Group. So just to give you a sense of how big those groups are, these are all of the organisations that are currently involved in those charities. And you can, I don't know if you can see them on there, but one of our members is the Health Research Charities Ireland, the umbrella body for the charities in Ireland looking at research. And a big shout out to Sarah Delaney and Avril Kennan. They come to our meetings, learn from us, and then they tell us about what's going on in Ireland, and we learn from you guys. So it's been a real spirit of international collaboration, which has been fantastic. So that's a kind of context of what I'm going to be talking about, the challenges and the way that we're trying to address them that I'm going to talk about now. It's not about me, it's about people from these organisations and the people with lived experience who they work with. So I just want to really credit them. So I don't know if this is the case for you in Ireland, I suspect it is, but historically in the UK, the involvement community has not been very diverse. It's been predominantly white, predominantly older people because they've often got time, and predominantly women, we think. But we didn't really know that. We just had that sense by literally looking at people in the room. But yeah, literally, we didn't really know who we were involving. We didn't have a sense of necessarily who we were involving across the piece and how diverse they were. We found, or I've found, and I know other people are finding, it's very, very easy to say that you need more diversity amongst the people you involve. And I have a real issue, particularly with senior leaders, thinking that if you say that, as if by magic, it automatically happens. That if you change the images that you use on your website, that somehow that's going to mean that you involve that diversity of people. And it's just not true. I think we all know that. So we really need to think about what we're going to do to meaningfully involve a more diverse range of people. But as I said, it really takes a lot of time and resources. You can't just say you're going to do it and then bingo, it happens. So just going to tell you about some of the things that we've been trying in the UK. So the first thing that's been happening is that we have been trying to understand more about exactly who's involved already. So some of our charities have been surveying everybody who's already in their networks and asking them about the different characteristics that they have. Other charities are also asking people when they sign up to get involved, tell us about you. You know, tell us, what ethnic origin do you have? Or do you have a registered disability? A whole range of different things. So we're learning about who we involve, and some charities are finding that they have a more diverse range of people than they thought they did, which has been interesting. We are also, so we're being really clear, we're trying to be clearer about who we want to involve, because I think that's another thing. It's very easy for senior leaders to say, we want to involve a more diverse range of people. But what do we mean by that? And for some organisations, that might not mean particularly people with what gets called in the UK protected characteristics. So, for example, we've got some groups in the UK that are saying we really want to reach out to people from rural communities. We've found that almost everybody we're involving comes from towns or cities in the UK. We want to reach out to people in more rural communities. Or they're finding we think that we're involving people from more wealthy communities, and we're not involving people at the poorer end of society. We're not involving people who find internet access challenging. So we want to target those people. So we need to be really clear about who it is we want to involve more. And then what else we're seeing in the UK is that there are specific projects being undertaken by some charities who are spending time and energy and money to reach out to and work with different groups of people. So a couple of examples. Parkinson's UK is, as it says on the tin, our big Parkinson's charity in the UK. Some of the staff who work there were very affected by what happened in the Black Lives Matter movement, and didn't realise, but pointed out to their leaders that most people who were involved at Parkinson's UK in their research network were white. So they've done a piece of work which has been going on for a good 2 years now, to say, right, this is a priority community, or these are some priority communities that we now really want to meaningfully involve. And one of the communities they've decided they want to involve more is people from the African Caribbean community. So they've been going into some of our areas of London where more of those people are, and doing events in partnerships with local communities there. And that's meaning they've now got more people involved. It's very, very slow and time consuming, but it's starting to happen. Bliss is our charity for babies born prematurely or babies born very sick. And they again realised that they weren't involving very many people from minority ethnic groups, but they also realised that they weren't involving many people who weren't the birth parents. So they weren't managing to reach many dads, they weren't managing to reach many non-binary parents, and they wanted to make those a priority. So one of the things that they've done is they've used small pots of money to resource people who are working closely with those communities to get them to ask people what would help them to be involved. So it's a small step, but I think it's a meaningful one. And then just finally on this topic, which I know is a huge one, we are trying in our Charities Research Involvement Group to work together, to learn things together. So we've run training for our members to think about how do we involve a more diverse range of people. And we just, last month, launched this film, which was co-designed, co-produced, co-everything with people with lived experience. And it aims to reach out, or to be a tool that we can use to reach out to people from minority ethnic communities to encourage them to get involved in research. So we partly paid for that as a group, and it means that all of our member charities can now access that film and use that film, which is really exciting for us. Anybody have this as an issue? Like, how do you capture the impact of involvement? Yeah, it's such a one that goes round and round and round, isn't it? So we ask our members every year, what do you want to talk about this year? And this has been a top topic, I think, about the last 5 years. And I almost feel like I can't bear to talk about it anymore, because we keep talking about it. Because there is a pressure on those of us working in this field to prove that involving people with lived experience adds value, which is interesting, isn't it? Because I don't think we get asked whether involving doctors or nurses adds value, but suddenly we involve people with lived experience, we have to prove it's useful. I've also seen, and I'm sure you have, that there are now so many tools that you can use to capture impact. It's almost like I'm just blinded by the range. My partner says this about yogurts, I say this about impact tools. There's just so many. And I think because we work with researchers, there's a pressure to produce information that's like hard information, like numbers, quantitative information, because that's what is seen to be most valuable. And I think that's really hard because we work in a field that's about relationships. So it's hard to quantify things. I also worry that if we spend too much time trying to capture impact, we don't do the work and have the impact that we're meant to be capturing. So it is a big challenge. So here's what we're doing. We've spent quite a lot of time sharing experience. I think we've probably done that one to death now, people talking about how difficult it is. We don't want to talk about that anymore. We had a big workshop on this earlier this year, and as a result, what we decided to do was to set up a project to review some of the free impact tools that are available, because some of them you have to pay for. So we completely ruled those out because we haven't got any money. But we set up a small working group, and I want to thank them because they've been amazing. And we looked at a range of impact tools. So I don't know if you can see in the tiny writing there, but we looked at all these tools. We tried really hard to act like researchers. I'm not a researcher, I'm a community worker. But we tried to be like researchers, and we scored them on different criteria. And then we came up with 4 tools that we particularly liked. And what we're doing now, I'll tell you about the tools in a minute, but what we're doing now is we are encouraging our members to try, hi Emma, you can see I've been in Ireland for a week, I know people by name now. We're now encouraging our members to try any tool, but particularly the 4 tools that we like the most. So I'm just going to tell you briefly about these 4 tools. What I particularly like is a couple of them are from Canada, so I thought that was quite international as well. So first tool, as some of you may have seen this, they all begin with P except for one, which also makes me even more confused. But the first tool is called PEAT. And it's from McMaster University in Canada. And it's basically 3 questionnaires. So it's fairly simple. I like that. I like simple. One's for people who got involved, one's about the project, and one's about the organisation. And what our working group said was, it's really clear, it's really comprehensive. You can use your own survey platform to run these surveys. And we thought that what it would be useful is evaluating involvement on an ongoing basis or on a one-off basis. We thought this could be a really useful tool. So that's the first tool. Second tool also begins with P, and it's called PIRIT. So PIRIT was co-designed, again, with people with lived experience in the Marie Curie Research Centre in Wales. And it's a great big spreadsheet, basically, is how it works. And it uses these things called the UK Public Involvement Standards to help you assess how did you perform against those standards. And those standards include things like diversity and inclusion. So again, our team felt like that was it's a simple tool to use. It's very easy. You could use it on a one-off basis or an ongoing basis, but it helps you track what's happening. So it's another really useful tool. Third tool, another one beginning with P, is Peers. So this is another Canadian tool, and it's a set of questions for completion by people with lived experience who get involved in research. So again, we feel like it's really easy to use, and it encourages people to reflect on their experience, and it uses numbers. So if you've got people who you're reporting to that want you to use numbers, we thought this was a really good one. And then just the final tool, and I won't talk any more about impact, is something that was produced in the UK by the National Coordinating Centre for Public Engagement. So that's a UK-based organisation, works across universities on the public involvement, public engagement sphere, and they've produced this template. That's it. That's how simple it is. It is literally just that. And that was what we liked about it, that it is very simple and straightforward, and we felt like it's a good framework, and it's based on this logic model idea, which apparently is quite well known and accepted by academics. So, hey, that ticks a few boxes. So what we're doing now on Impact is, as I say, we're trying to encourage our members to just try one of these tools out, even on one small project, to see if they like it, to see how it works. Because we need to get more stuff out there about how this is being done, how are we capturing impact. I'm going to talk now about payment. So there is a move in the UK, and I know that you're having this here as well, about the importance of paying people with lived experience for their time. So not just paying them for their expenses to come and be involved in a project, but paying them for their time, recognising them for their expertise. But there are some real challenges with this, and I think we're still learning about what these challenges are. So our members, obviously, if you work for a charity, you've got to be really, really careful with money. And I'm sure you have in universities as well, but I think it's more important in charities. So one of the things we wanted to be able to say to our senior leaders in charities was, if you pay for involvement, you increase the diversity of people you involve. We cannot find research evidence that says that, which I think is really interesting. We think it's the case anecdotally, but there isn't anybody who seems to have done like a really detailed piece that you can point to about this. So there's that one. For some people, their organisation is very clear that they don't want to pay, and we think within a charity sector that's fine. You shouldn't force people to pay if charities can't afford it. particularly if they think they can't afford it in the longer term. So I don't think you can start paying people and then a year later say, sorry, we've run out of money now, we're not going to pay you anymore. So that's really tricky. There's also a real challenge for getting the policies and processes in place to pay people with lived experience. We're finding in the UK that's particularly difficult if you want to involve refugees and asylum seekers, because they are so penalised if they earn any money for whatever they do. So we're going to ridiculous lengths to pay those people. It's crazy. And the other thing, which is a new learn for us, is that we are getting what is being called in the UK more ineligible involvement. So if researchers advertise an opportunity to get involved and put some payment with it, they are getting people signing up to be involved who don't have the lived experience that they're looking for. So Bliss, the charity that I was talking about earlier, have a sister charity called SANS, which is about stillbirth and neonatal deaths. They advertised an opportunity to be involved in a research study, so not take part in, but be actively involved in, having a say in the research study quite recently. They invited 15 people to be involved. On the day they found that 13 of them actually didn't have experience of stillbirth and neonatal death, which we're not seeing those levels of what's being called ineligible involvement when we're not offering payment. So it is an interesting thing that hadn't even occurred to me. So some of the things that we're doing, we've got a shared learning group set up specifically to talk about payment, and Health Research Charities Ireland are part of that, and then sharing our learning in Ireland. And we're not just sharing what we're doing, we're trying to share policies and processes and things like that. So that's been really good. We're also sharing, we've just done a benchmarking exercise to find who's paying, how much are they paying by the day, by the hour, and if they offer payment, how many people claim it. Because if you've got to work out a budget for your involvement activity across a year, you probably want an idea about how many people are actually going to claim. We're finding in the UK about 75% of people who can be paid to be involved across charities are actually claiming the payment. And the same, only 75% only claim their expenses. So some people are not claiming at all. Some people are claiming and then giving the money back to the charity. So it's very interesting. So we're doing that. We're also drawing on the learning of others. So just gonna draw your attention to 3 publications, one of which launched yesterday, so it's hot off the press, and done in partnership with our Irish friends. But we look to the NIHR for lots of our guidance, so this is one of the ones that we find particularly useful. So they've done a lot on how to pay people with lived experience for their involvement. They've also produced, in partnership with a number of other organisations in the UK, this guidance on what to do about what they're calling ineligible involvement. And then the third thing that is on the slide there is this new guide that we launched yesterday, which is about fair market value for charities when they go into partnership work. So we know that if you're in a charity and you get asked by researchers to help them find and support people with lived experience to be involved in a research study, that takes you time and effort. That takes you away from other things that you could be doing in a charity. So we're encouraging charities to think about whether they want to charge for their time in doing that. So it'll be interesting to see how much that is taken up. But certainly what we're finding is charities in the UK are charging, but they're charging very low amounts, particularly to pharma companies who we think could afford a little bit more. So that's payment. And just the last one, then I'm going to stop. This is one of our challenges, which I think is faced by everybody who's working in this field. And it's about how do you change the culture of your organisation so that we actually stop talking about involving people with lived experience in research, because it's just what everybody does normally. You know, that's what we need to get to, I think. So how do we get to that place? How do we get to a place where involvement is the norm? And how do we shift from just asking people for their views and then patting them on the head and telling them to go away and we go back to them in another year or whatever, to really doing things in partnership with people with lived experience. And how do we value that lived experience as much as we value learned experience? So those are some of the challenges that I think we've got in this field. And rather than say, like, what are we doing, I just want to share just a few things that we're learning about, that we've learned so far about how I think you can start to change the culture. So we know that getting buy-in and active support from senior leaders is absolutely crucial. If you don't have the buy-in of senior leaders, you can get so far, but then you hit a brick wall. So you need that active support of senior leaders. So that's why I think it's really important, like people like Sean are involved in this kind of thing. He is seen as somebody who's championing involvement, and how great is that? We need to make it really easy for staff to involve people. And at the moment, you know, lots of us are offering training, resources, but actually I think a really important thing is to do it alongside people. So if you learn to drive, you don't just learn to drive by reading the highway code, by reading the rules of the road. You want someone to come and sit alongside you and do those things. So you need to make it easy for staff. You also need to make it easy for people with lived experience to be involved. So you need the right policies and processes and resources in place, and you need to tell them how their involvement has made a difference. You have to build relationships, and I know that can be really scary, particularly for researchers who work in fields where they don't have a lot of human contact. So I know that can be scary. And we have to recognise that these things take a long time to do, so they don't just happen overnight. So in conclusion, I would say that none of us can do this alone. We need to learn from others. We need to share our learning, and we need to share what goes wrong as well as what goes right, so that we can all move forward more quickly. And I just want to finish by thanking everybody who's helped me to continue with my learning, particularly people in Ireland over the last few days who've been really generous with their learning. So thank you very much.